Hey guys, Dr. Ray Marque here, your local chiropractor back pain relief center. We're here with Wayne today. And Wayne, what are you, 19?
18.
18. So Wayne's a little young for low back pain, but he's a big dude, and we're not sure why he's having it, but we're having some discomfort in his low back. Not going down your legs at all, is it?
No.
No pain down the legs. So we're on our second or third week of treatment here. I would like him to respond a little faster, but we're going to kind of stick to our guns and decompress this joint, restores range of motion, get some inflammation down. Before this video, we'd already did some electric stim on him. We did some ice. We had him on a roller bed. So now we're going to move into the manipulation. So the first thing we're going to do is just check his leg length, and his right leg is a little shorter than his left leg, indicating we might have a pelvic imbalance. So I'm just going to use a drop table here and just realign it. And what I'm doing is pushing his sacrum and his ilium back to its normal position. Next, we're going to use our adjusting instrument, and it kind of helps me realign the back, break up any adhesions or scar tissue that might be there, and it makes my adjustment go a little easier. Alright, next we're going to use just our kind of industrial sized massager here. Just going to loosen the muscles up, bring some blood flow to the surface, all to make the adjustment go just a little easier. Okay, now let you lay your side for me, please. So now we're going to do a lumbar manipulation. Pull you out, just relax the head a little bit. We're going to bend that top leg. Okay, so what I'm going to do, I'm going to put a force through there just to realign that and break up any adhesions, decompress the joint. Good, nice and easy. Other side. Bottom one straight, just bend that top leg for me. Good. Okay, right through there. Good. Okay, come on up. We'll sit on the edge of the table. Joy's doing a great job filming. She's following me around, so she's behind the scenes. Chin down. Come all the way back. Just breathe out for me. Good. One more time. Good stuff. All right, guys, this is Wayne. Thanks for watching. We'll see you next time. Bye-bye.